5 on your health now. The future of child vaccinations was a main topic in a new interview with President-elect Donald Trump.
He was named Time Magazine's 2024 Person of the Year. In his extensive interview, he was asked about RFK Jr. Of course, that is his nominee for Health and Human Services Secretary. Kennedy's a noted vaccine skeptic, and the president-elect was asked if he would sign off on ending childhood vaccine programs, to which he replied, quote, "We're going to have a big discussion. The autism rate is at a level that nobody ever believed possible. If you look at things that are happening, there's something causing it." Well, join us now is Dr. Todd Ellerin, the Chief of Infectious Diseases at South Shore Health. Dr. T, thanks for joining us.
Good to be with you both.
Dr. Ellerin, as you well know, there is no connection between autism and vaccines. So what do you make of this false claim?
I want to underscore what you said, and there's also plenty of evidence that shows that there's no connection. Many studies, but it all started back in the late 90s when there was a small study, 12-person study that looked at 12 children, and there was a thought that there was an association between autism and the MMR vaccine. The problem
Measles, mumps, rubella.
Measles, mumps, rubella. The problem is it was a fraudulent study. So first of all, 3 of the kids in that study did not have autism in further investigation. The other point is that another 5 kids in that study had symptoms in the first year of life of autism before they ever got the MMR vaccine. And the lead author of the study had a major conflict of interest. He was involved in a legal case trying to link the MMR vaccine with autism. So it was retracted back in 2010.
And it was pulled back.
Yes.
Yeah. So despite that, and it was so long ago, do people still ask you about this?
They do. And the reason is there's a lot of mistrust right now, and there's cognitive dissonance, right? You hear something, and then you hear something that contradicts it. It can be hard to trust that. It causes a lot of psychological discomfort, and you can sometimes double down on the original belief. The problem is, in the UK where this study was done, what happened was MMR vaccination drops precipitously, and what happened was there was a resurgence of measles, and there was no decrease in autism. And that has been shown again and again in country after country where there have been decreases in MMR vaccination, but autism is actually on the rise. Why? Because the MMR vaccine is not the cause.
And let's be clear, vaccines save lives.
Thank you.
So are you concerned that this childhood vaccination schedule, immunization schedule, could become a political issue?
Ben?
I mean, it already is.
Measles does not care who you voted for. It doesn't care about your sex, your gender, your religion, your socioeconomic group. The bottom line is, in a susceptible population, it's the most contagious infection out there. All it cares about is whether you've been vaccinated or not. If you've been vaccinated, you're not going to get the measles. If you haven't been, you're very susceptible.
And remind us again, though, even if you or your children are vaccinated for measles or mumps, right, and there's an outbreak, it still does increase the possibility that you could get it, right?
It does, although generally speaking, it's going to increase it in the people who are susceptible. It is that good of a vaccine.
But the key to preventing these outbreaks also is everybody getting vaccinated.
Great point, because if you get the vaccine, not only does that protect you, it protects the community, and that's what's referred to as herd immunity.
Right. Okay, Dr. Todd Ellerin, as always, thank you for being here.
Thank you, Erica.